The following segment is sponsored by Providence Health and Services.
March is Colorectal Cancer Awareness Month. The CDC says it's the fourth leading cause of cancer-related deaths in the U.S. KATU is on your side, learning what you can do to prevent this deadly disease and what can be done to treat it. Back in 2015, a car accident saved Rodney Wyatt's life.
I missed a corner and did a rollover truck accident multiple times, knocked me out. I woke up when the two people were pulling me out of the window of the truck. And it was just like, whoa, what happened?
Rodney was rushed to the hospital. Doctors scanned him for internal bleeding. Those tests revealed he had low iron levels and enlarged lymph nodes.
So I started doing some blood work and some different tests to find out why my iron was low. And in that process, we did a colonoscopy. And during the colonoscopy, we found the tumor.
It was colon cancer. Further testing would return with even more devastating news.
And we found out that it was also in my liver, so it was stage 4.
At just 48, Rodney was diagnosed with stage 4 colon cancer.
I had no idea. I thought I was healthy. I had no symptoms, no idea I had cancer. So the accident and the colonoscopy is really what's allowed me to be here today, 8 years later.
Cases like Rodney's are common. In fact, they're the reason the recommended age for colonoscopies was lowered from 50 to 45. In some cases, that age is even lower.
If anyone has a family history of colon cancer, they should start 10 years younger than their earliest relative was diagnosed, or at age 40.
This is Dr. Kelly Perlewitz. She's Rodney's oncologist at the Providence Newburgh Medical Center.
She's been very helpful in deciding and working with me to decide what are the best treatments that we should take on.
Dr. Perlewitz has been with Rodney since the beginning.
I get to provide that ongoing care, and that's why I like oncology so much.
With her guidance, Rodney has participated in some clinical trials. He's also had several surgeries to remove portions of his colon, liver, and lung to treat the cancer. He continues to take daily chemo pills for maintenance.
I'm here more to educate them and share what resources we have, get them connected with clinical trials, that sort of thing. But really, we've got to find what works best for the patient.
Both Rodney and Dr. Perlewitz agree the most important form of treatment is prevention.
Get the tests that your doctors recommend because it could really save your life.
If we remove those precancerous polyps before they turn into cancer, you've prevented the cancer.
Even though Rodney has cancer, he can still live a relatively normal life.
Outcomes are definitely improving, and we're able to treat people and allow them to have a good quality of life for all that time as well.
That car accident and his treatment at Providence may have been what saved his life initially, but there's a big reason why he keeps fighting.
Well, I'm married, met my wife in high school, so we've known each other longer than we haven't known each other. We got 2 kids, a son and a daughter, Brandon and McKenna. My wife's Trinisha.
Rodney looks forward to spending many more years with Trinisha. He's excited to walk McKenna down the aisle this July and to attend Brandon's wedding next year. After you get your first colonoscopy at 45, general guidelines say to rescreen every 10 years until you're 75. These recommendations may vary depending on your personal risks, so the best thing to do is get your doctor's opinion first. We have information on our website at katu.com/familymatters.
We got to talk about this weather now. This is a live look at downtown